The faster a person experiencing a potential stroke can get the right treatment, the better chances towards full recovery will be for that person.
One of the challenges with stroke is that oftentimes it's difficult for people to get to treatment in time. Each minute that passes, the original estimate is that 2 million brain cells are dying.
My experience with stroke started unexpectedly at age 21. I went to a hospital, I went through some testing, and they basically sent me home. They said it was stress and I should go home and rest. So I went to another hospital, and it was there they diagnosed me with a stroke. That is not what should happen to somebody. You shouldn't have to go again.
In a system where a patient has to go to the closest hospital, that hospital may not have either the expertise or the protocols in place to really identify whether that patient has this type of stroke. They have to have neurologists or neurology specialists, and they need to have the systems in place to get brain scans very quickly to identify that blockage.
I learned that that is so important because there are some hospitals that specialize in stroke. And when you go to those hospitals, you get the treatment you need. And that's what this stroke bill has done. And I've been advocating for it for many, many years.
The American Heart Association here in Massachusetts is very active, bringing policy changes with the stroke law. It will positively impact, I believe, thousands of residents of Massachusetts.
This bill will save lives and also reduce the severe disability that can happen after stroke for many people.
The impact on my life is huge. They put me on disability at 25 years old. I had plans to change the world or make a difference. And when they told me that day, I just remember crying and being so upset because what I had planned was not going to happen. Running into the American Heart Association has been a blessing that I'm able to give back. I think I'm very fortunate to be able to advocate and to raise awareness for people.
I experienced a stroke 2.5 years ago. When I went public about having my stroke, it was important, I felt, to create more awareness in people of what stroke symptoms might be and recovery about stroke. The stronger our residents are, the stronger our communities are, and in turn, the stronger our state is.
When it passed last year, it felt like all of the work was worth it. So many advocates might be people who didn't get to the right hospital. You can't go backwards, but at least we can help the future stroke patients get where they need to go.